Thrilled to welcome Dr. John Fluky. I have known John for, I don't know, like 20 years. I mean, it's a long time. Something along like those lines, John. In the IT world, dental IT world, there's not a lot of us out there that are fairly prominent and well known. Myself, John, Paul Feuerstein, Marty Jablow, and like I said, John is definitely one of the pioneers here. He is in private practice in Lee Summit, Missouri. He practices 4 days a week doing direct patient care. He's also the technology editor for Dental Products Report, which is where I write my monthly column. He's chief dental editor, where he writes, edits, and does video demos of products featured in his technology evangelist columns. John has one of the most popular dental blogs on the internet. Most of you, I'm sure, have heard of it, Ramblings of Dentistry's Technology Evangelist. It has daily updates on technology in healthcare and technology in general. The site has over 2 million unique page views, which is amazing. He lectures extensively on all aspects of clinical dentistry as well as technology in dentistry. He's been featured at every major dental meeting in the U.S. and international occasions as well. Dr. Fluky uses technology in every aspect of his practice and personal life. He pushes himself to constantly be on the leading edge. Like me, he loves testing and breaking the latest gear he can get his hands on. He lives by the motto, you can't have too many toys, and I completely agree with that. He consults with manufacturers, helping with development of techniques and technologies and products, which allows him to see things from the duct tape and zip tie stage all the way through to the completed item. Dr. Fluky's passion is technology that improves patient outcomes. He's always working to create or to help create products and techniques that allow patients a better quality of life. He's also the past president of the Greater Kansas City Dental Society, as well as serving as the Missouri State peer-reviewed chairman. So, John, I am absolutely thrilled to have you here and looking forward to the presentation.
Let's get down to it. I've shown you some things that either you don't want to do or you don't want to have happen. But now let's talk about the right way to do IPR. And just to clarify, I want everybody to know I'm not a superstar. I'm not some golden-handed, gifted clinician that, has people lined up at my door to do aesthetic cases. And I don't have people flying into Kansas City where I live to have me treat them. I'm just a general dentist in the trenches. I'm just like all of you that are listening. And I honestly think that's probably one of the reasons the DentaSonic people wanted me to talk to you, is because I'm a GP and I see the same type of cases and I see the same situations that everybody that is at this webinar tonight deals with. When I started out doing ortho, as I said earlier, I didn't get any ortho training, or my ortho training in school was minimal. And that's just the way it was back then. That's not really a complaint. It's just a fact. But I started doing orthodontics when clear aligner therapy came along. And I didn't want to do wires. That seemed pretty complicated to me, and I just didn't want to get involved in that. So I stayed away from it, had several good friends who were orthodontists. I just let them deal with it. But when the clear aligners came along, and I saw that so many patients were coming in with ortho relapse cases where the molars are in great position, but almost everybody, I threw my retainers away, or I lost my retainers in college, or I lost my retainers in my 20s, or I just quit wearing them in my 20s, and now I'm in my 30s, 40s, 50s, and my teeth are starting to, they don't say rebound, but I'll say it because that's the term we use. My teeth are starting to rebound and, go back to the way they were, and all you want to do is just straighten them up. You don't have to drive the molars anywhere. And I was like, this is exactly the kind of stuff that I want to do. So I started doing this. And of course, one of the big things with clear aligners is interproximal reduction. I did the best I could with the instrumentation that I had available at the time. And for me, that meant a lot of microfine finishing diamonds that were super skinny. I love the microfine finishers that they're almost gray. They almost don't look like they have a grit on them. I do a lot of my composite initial finishing with them before I go into the polishing phases, and so those were what I used. I would either use a flame shape or a needle shape, and the grit on those is so fine that the burrs really look gray. They almost appear smooth or have like just a very little slight twinkle if you get them in your headlight, But my point here is that there was not much grit because I wanted to try and preserve as much enamel as possible. And I also used finishing strips or strips with a handle. So here's kind of a funny story about finishing strips with me. I started out with metal diamond finishing strips. They were serrated on one side. They had a coarse, they were divided into half. The front half was a coarse diamond, the back half was a very fine diamond. And they were used for a lot of things, interproximal finishing of composites and all kinds of things. And so we had those. And then they came along with the strips that have little C-shaped handles on them. And so we had two types of finishing strips. And because we had two kinds, if I'd ask my assistant, give me a finishing strip, she would always be, which one? And so one day I said, we got to figure out a better terminology here. So my assistant said, well, the handles, those little ones that you can hold between your thumb and forefinger, the handles are kind of C-shaped. Why don't we call them seesaws? She thought that was kind of funny. And then it was funny because I was like, yeah, seesaws. And then of course, after a moment, we both looked at each other and we were like, no, never say saw. So we thought that's scary. So we came up with the idea, we call them seahorses or a seahorse. So I know that the name sounds kind of goofy, and it is, it's really benign, but even though the word horse has nothing to do with finishing, to this day, which is like a decade later, we still call them seahorses. So go figure. But now let's talk about something better than strips or seahorses. So what's so special about DentaSonic? In a nutshell, this system allows doctors to really predictably and really easily create the needed space for IPR while also allowing you to maintain the contours and the finishing. So not only do you finish with a tooth shape, but you also finish with a tooth polish, which is really nice. Developed a quick point of reference that helps me adopt when I'm looking at new technologies. Over the years, I really have done a lot in tech over the years. As Lauren said, he and I have both been in this since the 90s, or for me, the very early 90s. And so I came up with 3 questions that I use when I'm looking at something. I'm like, do I want to bring this into my practice? Do I want to introduce it to my patients? So question number 1 is, does it give me at least the same result or a better result than I was getting before? I said before, whether you are the chairman of the board of a dental supply company or whether you're a dentist in the trenches like myself, we all work for the patient. So I need to make sure that quality wise, if I bring something new on board, I'm not taking a step back. I want to put my head on the pillow at night and know that I gave the patient my very best effort. If you give your best every day, you'll be successful, hands down. For you young dentists, don't concentrate on money, concentrate on your patients and concentrate on results, and you will have more success you know what to do with. Question 2 is, does it save time or effort? And that works for both the patient and the doctor. No patient wants more dental appointments, more checks, or they don't want those appointments to take any longer. I've been at this for a long time now. I have never had a patient say, can you slow down? Can this take longer? Can you drill for like another half hour? Or I've never done an endo and said, we get done and could you put the rubber dam back on for like 15 minutes? Because I was enjoying that. People want to get in and out. And I get that. We're all busy. I'm busy too. There's also the advantage of the time savings for the doctor. The less time you spend doing dentistry, either the more patients you can see, if that's what you want to do, or the less stress you put on yourself. And this is an interesting thing that I always want young doctors to know, because I was at one time bulletproof and I was never going to die and I was never going to be, the person that I am now. But I learned a statistic about 15 years ago that just stopped me cold, which is well over 60% of dentists that become totally disabled from work-related injuries do so because of neck and back issues. So because of that, I became a big fan of efficiency to make my procedures last less time. And it took me out of what I call, I'm making air quotes, the clinical posture. Um, because the less time I spend, in that posture that we have to be in to treat patients, the less strain it puts on my body. You can practice longer, you can fund your retirement longer, and you can help the patients that trust us. Also, if the doctor isn't physically fit and can't practice, um, that affects a lot of people. It affects the doctor, it affects the team. Because in a busy dental office, everybody earns a living because the doctor is there. So if the doctor suddenly ends up having to retire because they can't practice anymore because they're injured, everybody in that office has got to find another job. And I wouldn't wish that on anybody else. The third question I ask is, does it cash flow? So it's, do I get as good a result or better? Does it save time or effort? Does it cash flow? I don't like to talk about money much because, as I said a couple of minutes ago, I've always felt that if you give your patients your absolute best and look out for them as people, you'll do fine. But there's also the simple fact that you can be the best operator on the planet, have the best hands, the best skills. But if you cannot stay in business, those hands and those skills will not help anybody. So you've got to look at how does this work as far as costs as well. So take a look at this. This is what DentaSonic allows you to do. It gets you through the contact point really quickly and really easily with a little thin saw. You can then, once you've got that initial little space created, you go in there with this less aggressive, not coarse diamond grit, and you then smooth the tooth, keeping the right contours, and you don't end up with these flat spots between the teeth. They have these really great, and I'll show you a picture or pictures of the kit and the refills of the situation before we're done tonight. But these strips are in really close tolerance thickness classes. So when you pick up a 0.1, you know it's a 0.1, and that helps you do your job better because you're not picking up a burr and like, oh, I need 0.3 millimeters. Oh, that looks kind of like 0.3 millimeters. You know that you're finishing to 0.3 millimeters or whatever it is that you need. And then they have a little polishing strip called the poly strip, and you go in with that at the end, and that takes away all the scratches and all the roughness, and it then gives you an interproximal surface that your patient can maintain, and it gives them health, for their lifetime. So how do we do this? We do it with a reciprocating handpiece, and that means that these strips are going back and forth and they're not spinning like a traditional turbine or electric gear handpiece. So it works a little like a little saw. It goes back and forth and back and forth and back and forth. And it takes those abrasive strips and it moves them, in that motion. The strips are engineered to these thicknesses, and they're flexible, and that's a really key point. When they're flexible, it allows you to apply the pressure where it needs to be applied, and as you go through that contact, you can then move the strip more towards the tooth to help maintain those contacts. They're very precisely engineered, so you know exactly what you're getting. And then that poly strip just lets you polish it back to like a glass-like uh, smoothness. So when I used manual strips, it was really kind of a chore to use them correctly. I had to be really careful of the lips and the tongue and the commissure of the mouth. Even just the edge of a strip can create a tiny slice in the lip. And while that isn't something, that could cause you a big cosmetic problem in the future, those suckers do hurt like crazy for 2 or 3 days. And I always hated telling patients, well, I'm sorry, but I got your lip a little bit with the edge of this thing. It's kind of like a paper cut, and I'm sorry about that. It's not going to be a big deal, and it's going to stop bleeding in a couple of minutes. Sometimes we have to apply a little pressure, but I always feel bad about it. I'm a Midwestern Catholic guy, and I feel guilty about everything. So this is just one more thing to throw on the fire. So I also had the little seahorse strips, and those were sometimes a better option, but they were still hard to use. I didn't cut very many people when I was using those. Um, but they were kind of hard to use. They were kind of hard to get the right um, reduction done. And what I've found is handpiece is just so much easier and it's so much more simple. As dentists, we're so used to that feeling of the handpiece, that instrument in our hands just gives us a tremendous benefit. It's easy to control, and that makes it good for the doctor and the patient. So when we're looking at the teeth, how much can we really take away? And these were some studies that were done at the University of Heidelberg, which is why their logo is here. And generally speaking, we have a limit of 0.5 millimeters of IPR. And what that means is that allows us to take about 0.25 millimeters from either side. And that keeps you in that zone if you still have enough enamel that you have, enamel for a lifetime there, you've still got, the adequate thickness that you need. And that's one of the really critical things I think about DentaSonic is that because the strips are engineered to these really tight tolerances, you know how much you're taking away. And they make the strips in both a two-sided and a one-sided version. So if you've got a tooth maybe that's a little bulbous and maybe you can it can spare a little more space, you can use one of those one-sided strips. Or if you've got adequate space on one side but not the other, they're very easy, and it just helps you to be super conservative, yet you get the results you need, and it keeps those contours that nature put in there at the factory, which is really, I think, really important. The whole idea is you're not supposed to take away more than 0.3 millimeters of proximal substance. So that means that you take away 0.25 on each side and you're fine. So this just kind of look like how much can we take away on the tooth. And I'm not going to dwell on this slide very long. Charts are great. If you really want to know about this for later, grab your phone real quick and take a picture. The main takeaway I want you to take from this is that removing enamel and creating space should not be what I call a best guess scenario. It should be as precise and accurate as possible. So that accuracy isn't even remotely possible with a handpiece and any type of burr. I don't care how skilled you are. Using a diamond burr does not allow for you to have the amount of control necessary to perform really precise IPR. The process of IPR should be done using a precision system with precision instrumentation, and you can't eyeball a process like this. And I will gladly admit, before I found DentaSonic, I was not nearly this precise. Now, when I approach these cases, I do it with the peace of mind that comes from knowing that I've got more control and more precision than I used to have. And the thing to remember here is that when you're dealing with these type of thicknesses or distances, we need to be accurate. So think about this. We like our crown margins in pros. The digital scanners that are available today, the crowns that you get back from your lab or that you're doing in-house with a mill, is we want those margins accurate to about 50 microns. That's the dental standard. 50 microns is 0.05 millimeters. And we all know that's a tiny distance. I mean, even though that's a huge distance to us in dentistry, we know in the real world, I mean, I tell people a lot of times in my practice, I'll tell patients, I live in a world where a millimeter is a gargantuan distance. And we all know, all of you listening, you know it is. So when you're talking about doing IPR and the partner company that's giving you your clear aligners, they give you your map and they say, in this area, we need 0.5 millimeters. That's 0.25 millimeters per side. And that is 250 microns, which is only 5 times the width of a crown margin. So we're talking about a quarter of a millimeter. would you trust your unguided hands to remove that amount of tooth structure? I ask that because I've been practicing for a number of years now, and I like to think that at this point in my career, my hands are pretty good. Now, that's not me trying to make myself look good. It's just that Malcolm Gladwell, who's a great author, wrote a book that some of you may have read, but if you haven't, you should. Gladwell wrote a book called Outliers. And in that book, he puts forth the idea that to be really good at something, it takes about 10,000 hours of experience. So I've never sat down and figured out how many hours I've spent doing dentistry, but I'm sure that it's probably a lot more than 10,000. So hopefully, following the rule of 10,000, I've got decent skills at this point. But if somebody came up to me and said, Fluky, sit down and go between these two teeth and only remove 250 microns of tooth structure, let's say on the distal aspect of the first premolar, I'm not sure I could say, yeah, piece of cake. I'd probably say, well, I'll do my best, but it's really hard and I can't guarantee you that I can do it. So what I really love about DentaSonic is it gives me much more control and much more comfort in doing things like that. So reminds me of placing implants. You know, before we had CBCT and we used surgical guides, implants were placed by people that had really good hands and lots of hours of implant placement. And now that we have surgical guides, we can get ideal results by using a tool that helps us be more accurate. It helps our hands perform. And that's how I feel about IPR, is DentaSonic just makes me more efficient and more accurate. It makes my job easier and it gives me a better result. So the enamel thickness of the teeth, you know, it varies due to the tooth in question. However, the thinnest enamel layer on any of the teeth is the maxillary incisors, or I'm sorry, the mandibular incisors. And for those teeth, the average enamel thickness for the mandibular incisors is about 0.68 millimeters. So what that means is even in situations where you're doing 0.5 IPR, removing 0.25 millimeters from each side still leaves you 0.43 millimeters of enamel, which is plenty. So, but if you can accomplish this by carefully doing IPR with a precision system, trying to do this with a thin, coarse diamond burr and removing only 0.25 millimeters, it's not something that I think I could do. And I'll gladly admit that even if I sat down and you challenged me to it and I did it and I got it once, that's probably the most that you would ever see me hit. Because it's just hard to do with just your eyes and your hands. And as the need for IPR decreases, if you need like less and less structure taken away, you've got to be more and more precise. So if you need 0.3 millimeters of space, that means you're going to be removing 0.15 millimeters on each side, and you just got to be more accurate with that. And I'll gladly tell you that I am not that good. I'd like to tell you that I am, but I'm not. There's no way I'm that good. So how much enamel can we, get and reduce on a tooth? If you look at the maxilla in this one, this is a European numbering system. So the way the FDI numerical system is that the centrals are 1, the laterals are 2, and the canines are 3, and then you go off of the quadrant. So like 1-1 is the right central, 2-1 is the left central, which is kind of a cool way of looking at things. But in those contact points, you can basically get about 3 millimeters of space. That's how much you can gain. If you can go, further back and go from first molar to first molar, which is 6 to 6. In fact, I think it's really great. Some of my friends that are not American dentists, when they refer somebody for third molar extractions or wisdom tooth extractions, they'll talk about extracting the 8ths because the third molars are the 8th tooth in the arch, which I think is kind of cool. So working 6 to 6, which gives you 11 contact points from first molar to first molar, you can gain about 6.6 millimeters, which is a decent amount of space. On the mandible, it's pretty similar, but a little less. So from canine to canine, you can get 2.6 millimeters. And then if you go from first molar to first molar, you can get 6.2 millimeters of space, which, you know, is a decent amount of space to gain when all you're doing is trying to rearrange, like maybe canine to canine, and not worrying as much about the premolars. And, you know, especially on these rebound cases or relapse cases, the molars are locked into position, so those are even easier to deal with. So it's also handy when you're dealing with the Bolton discrepancy. For those of you that don't know, I'm not going to make a big, long oration about the Bolton discrepancy, although it's very, very interesting. The Bolton analysis, just real quickly, is a tooth analysis. It determines a discrepancy between your maxillary and your mandibular teeth. So the formula is basically the percentage obtained by adding the sum of the widths of the 12 mandibular teeth divided by the sum of the widths of the 12 maxillary teeth. And it ought to be about 91.3. So you can use this to analyze just the anteriors, or you can use it to analyze the entire mouth, depending. It's a great way to analyze space. One of the other things that you can see here is these centrals are a little wider. They're outside the golden proportion a bit. So you've got, you know, some contouring that you can do here. And once again, taking a flexible strip and passing it through those areas and keeping them that way is going to be really, really nice. Gives you a good result. Now, this is some electron microscopy that I wanted to show you. The above portion of this is before the poly strip was used, and then that lower portion is after that poly strip is used. And once again, this is from Germany, and that's why we've got the logo here, and that's why the black bar down there is not in English. But what I want you to really look at on this is look how smooth that finish is, and that's from that poly strip. So you don't have to leave the teeth scuffed when you're done. You can really bring them back and make them beautiful. So this is just some more scanning electron micrographs, SEMs, and you can see the untreated and the treated in that image on the left. And then we're just zooming in more and more on these, 500 times on the left, 2,000 times in the middle and on the right. So this is some great stuff to use. This is the kind of thing that you want to end up with when you're done with IPR, and getting a result like this. Trust me, you just can't do this if you're winging this with a needle diamond or a flame-shaped diamond. You just can't do this, and you really can't do this even with really nice seahorse strips. It's really hard to do, but doing this with a handpiece that goes back and forth, and it, you know, goes right where you want it to go, and you can control the pressure, you can get some amazing results with DentaSonic. So I know I showed you this slide earlier. I put in here a second time just to reemphasize how really safe and easy this DentaSonic system is. It's quick, it's gentle. Each strip is a precise thickness, so you know exactly what you're doing. And then, as you just saw in those SEMs, once you've achieved the right amount of IPR, you can polish the enamel to the point that it just almost looks like glass. It's really incredible. So let's take a look now and see, how do we use this? So here's the handpiece. We've locked it on, and then the little saw goes in there, and this opens the space. And then you'll notice we're just going to go through these. We're going to go up in width as we do this. So going through each time, that strip is getting a little bit wider until we're all done with that. And then this is that poly strip. And you'll notice all of these are very flexible. They bend when you're doing that, and that gives you that really nice, smooth, glossy. You really can't tell that anything was done. And look at the contours here. The contours are really, really natural. And that's what we're trying to get. We don't want those straight up and down shovel-shaped incisors. So they make this in a couple of versions. The one you just saw is a contra angle. It goes on an e-speed motor, which will work on any electric system. It will also work on an electric endo motor if you'd like it to. But this is the cordless version, which is really nice because you obviously don't have to have this hooked up to an air hose. And it is really cool. One of the super cool things I think about this is that not only can you use it for your IPR, but you can also use it for polishing composites. And then that bottom point, you can use it for endo. So this, in addition to being a cordless IPR motor, it's also a cordless polishing motor, and it's a cordless endo motor. So it does them all, which is really, really cool. So, this is kind of a 3 temperatures, 1 detergent kind of situation. We've got one motor that does 3 different things. I think that's amazing. I mentioned a little while ago, I was going to show you some kits in here. This is the starter kit 2. And as you can see, it's got the e-speed contra angle on there. And then it comes with everything that you're going to need, all the strips with all the thicknesses. And then one thing I do want to point out to you, on the right-hand side of that box, on the bottom portion, you'll notice a little kind of goldish thing there in the middle that looks like a key. That is a thickness gauge, and it looks like a little key ring. You take those out, and those little keys are each the same thickness as the different strips. So if you want to make absolutely rock solid sure that you have the amount of IPR that you need to do the case, you can take those keys out and use those as thickness gauges. Very, very handy. But everything you need is here. You can also get this little basic set, which comes with the contra angle and then one of each of the strips. And that's a better picture, I think, of the little gold key thickness gauges that I just talked about. Very handy. And then if you want to, you can just buy the hand pieces. Only real difference on this is that third one, the DS Twist 40. It has a little bit higher speed. It's a 40,000 RPM as opposed to the others are 25. But all of these work really, really well. And if you don't have an e-speed motor, you can buy that motor on here or from these folks as well as the contra angle. And then when you're done, or when you've got this and you've used it for a while, and when the strips are done, then how do you replenish your supply of strips? Well, they sell the resupply kits, so you can buy them in a 12-pack. You can buy them in an assorted 5-pack as well, or you can also, if you just want one certain thickness, you can order those as well in 12 or 5 packs. So you've always got these available. You always got these handy. One other thing that they've come out with, which I think is really nice, this is kind of a recent change, is along the arch there, the colored arch on these, they also have the thickness. So you don't have to just memorize the color and know this color means this, or like the yellow strip is a dia strip. You can look at it and actually see, oh, this is the 0.10, this is the 0.20, because it says so right on the little arch, which once again is handy. They're color coded, but in case you forget what the colors are, there's a number there to remind you.